And welcome everyone. Myself Dr. Himanshu Dave, and I am starting this initiative for students who are preparing for PDCET Pediatrics. This is previous year question series, and I will bring lecture wise few questions every day or every alternate day, and most of the questions will be from those questions which were asked in the previous year examinations throughout the country. So a good number of weightage is given to the previous year questions, either directly or indirectly. Those questions are repeated in all the exams, especially PDCET and NEET PG. So we will go through these questions quite fastly. First few lectures will be like demo lectures only, and then I will start giving more and more questions to you on my YouTube channel. So if you want to get more questions, then you can subscribe this channel, and daily video will be uploaded for the PYQ from Pediatrics. Okay, so let's begin. First question is, premature closure of sagittal suture is seen in dolichocephaly, scaphocephaly, both or none. So answer is both. That is, you have to remember that premature closure of sagittal suture is shown in dolichocephaly and scaphocephaly. Next is average weight to casein ratio in breast milk is. This is important, has been asked previously, that weight to casein ratio in breast milk is. So the answer for this is weight to casein ratio in breast milk is 60:40, and in cow milk it is 20:80. So this is important. Remember these two values. Weight to casein ratio in breast milk is 60:40, and in cow milk it is 20:80. Now para-aminobenzoic acid of breast milk prevents infection of PABA, para-aminobenzoic acid, which is present in breast milk, and it prevents infection of Giardiasis, E. coli, malaria, or H. pylori. So correct answer is C, that is malaria. So question can be asked that which of the following content of breast milk prevents the infection of malaria. So answer will be PABA. Which of the following is a mismatch? So you have to identify the mismatch. Options are Q bending quinacrine, C bending sodium hydroxide, R bending acridine orange, and none of the above. So these are the reagents given of the following techniques. So C bending technique is used in barium hydroxide. In C bending technique, barium hydroxide is used. So this is mismatch. And Q bending, Q for quinacrine, R bending we use acridine orange, and in C bending barium hydroxide is used. Now this question, clinical base, a 15-day neonate presented skin changes as shown in the image with focal seizures. Now I'm sorry for this, image is not available here. I will upload it later, so we will just skip this question. Now chromosome involved in Charcot-Marie-Tooth disease is 1, 5, 11 or 19. So answer is A, that is chromosome 1 is involved in CMT, Charcot-Marie-Tooth disease. And common associations with chromosome 1, you have to remember Charcot-Marie-Tooth disease is 1, RH system is associated with chromosome 1, neuroblastoma is associated with chromosome 1, and NPHS2 is also associated with chromosome 1. Now enzyme replacement therapy is available for all of the following except, so be aware of this except one. So enzyme Gaucher's disease, Pompe's disease, Fabry's disease are available for all of the above disease. So answer is D. So you have to remember that enzyme replacement therapy is available for Gaucher's disease, Pompe's disease, Fabry's disease. So from any PYQ, just try to gather more and more information as much as possible from the options and try to remember all the options given in that question. Next question is, which of the following is subperiosteal? Caput succedaneum, cephalometoma, subgaleal hemorrhage, or all of the above. So which of the following is subperiosteal? Answer is B, that is cephalometoma is subperiosteal. So let's go through the differences between caput succedaneum, cephalometoma, and subgaleal hemorrhage. The location of caput is subcutaneous or extraperiosteal. Cephalometoma is subperiosteal, 2.5% of all live births, and subgaleal hemorrhage is seen under aponeurosis. The extent, this is important, caput crosses suture line while cephalometoma is confined by suture lines, and subgaleal hemorrhage extends in subgaleal space from orbital ridge to nape of neck. What are the complications expected? In caput, it resolves by a week or two. Cephalometoma resolves by 8 to 12 weeks. And in subgaleal hemorrhage, you can see jaundice, blood loss, shock, and mortality. Now, another question, most common type of tracheoesophageal fistula. These are direct one-liner questions. So answer C, that is type C. So most common type of tracheoesophageal fistula is type C. Okay. Next is, which wave of Bera which wave of Bera corresponds to nucleus of lateral lamnicus, wave 1, 2, 4 or 5? So answer is D, that is wave 5. So just go through the waves of Bera, which corresponds to first and second waves corresponds to cochlear nerves, third wave to cochlear nucleus, fourth to superior olivary complex, fifth to nucleus of lateral lamnicus, sixth and seventh to inferior colliculus. So the waves of Bera you can remember with this slide. So thank you everyone, and this was a short video, and simultaneously in the coming days I will be uploading more and more lectures with more and more MCQs, mostly which have been asked previously in any of the competitive exams from pediatric specialty. So if you want to revise more and more such questions, you can please subscribe this channel and you will get more and more videos regularly. Thank you very much for your patience.